Hello, my
Hello.
name's Megan. What's your name?
Donald.
Hey, Donald. What we're going to do today is a cranial nerve assessment. We're going to do some range of motion exercises, and then we're going to take a look at your abdomen, okay?
No.
So let's run through your cranial nerves. We're going to do cranial nerve number 1. That's your olfactory nerve. Close your eyes and tell me what you smell.
Perfume.
Okay, very good. Cranial nerve 1 is intact. That's your olfactory nerve. Now we're going to do cranial nerve number 2. And all you have to do for that is cover up your left eye and just read the smallest line that you can.
Man, you have the thing upside down.
Oh, go ahead.
T-O-Z.
Okay, read the smallest line that you can.
T-O-Z.
Okay, now, but with both eyes, read the smallest line that you can.
L-P-E-D.
L-P-E-D. Okay. All right, so we see that your optic nerve is intact. Now we're going to go over cranial nerve 3, 4, and 6. That's your oculomotor, trochlear, and your abducens. And just follow the flashlight, okay? All right, just with your eyes. Good. Okay, now I'm just going to take a look in your eyes from the side. And I can see that your pupils are equal and round and reactive to light. Okay. And now just follow the flashlight as it gets closer to your face. Good. Okay, so cranial nerve 2 is intact. Cranial nerve 3, 4, and 6 is intact. Now we're going to do a test of your trigeminal nerve. And basically, just clench your teeth like you're biting down on something really hard. Okay, your masseter muscle is strong, your temporal muscle is strong. Close your eyes real quick. Okay, good. Now I'm going to touch you somewhere on your face. Just tell me where I'm touching you, okay?
Nose.
Okay, good. Now we're going to do your facial nerve. Just go ahead and look up at me and then smile. Brown. Okay, so cranial nerve number 7, your facial nerve is intact. Now we're going to do cranial nerve 8, that's your acoustic nerve. Go ahead and cover up this ear over here, and I'll walk over here and whisper something, and you tell me what you think that I'm whispering to you, okay?
Pancakes.
Okay, good. Next we're going to do cranial nerve 9 and 10, that's your glossopharyngeal and your vagus. All you got to do is open up, ah, like that.
Aww.
And we can see that your uvula rises midline, so we know that cranial nerve 9 and 10 are intact. That's your vagus and your glossopharyngeal. And yeah. Next we're going to do cranial nerve number 11, your accessory nerve. Sit up straight. And I'm going to push down on your shoulders. And when I push down on your shoulders, you go ahead and just push up. Well, that was easy. Okay. Cranial nerve number 12 is next. That's your hypoglossal nerve. And go ahead and just stick your tongue out. Go. We can see that your tongue rises midline. So we know cranial nerve number 12, your hypoglossal nerve, is intact. Now we're going to do a few little exercises. Put your finger on your nose, please. This finger to nose testing. And then connect your finger to my finger. And then back to your nose. Okay, finger to nose testing checks out. Now I want you to sit up straight and put your hands on your lap and then try to go back and forth as much as possible. So the rapid testing checks out. Do the same thing with tapping your feet on the floor at the same time. Rapid alternating testing. Good? Okay. Now I want you to stand up. Close your eyes. Put your feet together, heel to heel, toes to toes. There we go. Keep your eyes closed and just hold that for just a second. This is called the Romberg test. And all I see is just an itty bitty bit of swaying. So that's what we want. The Romberg test checks out. Go ahead and lay down flat on the couch, please. Scoot down just a bit. Okay, now we're going to do a heel to shin test. I want you to take your heel of one foot and rub it up and down the shin of the other foot. Good. Do it on the opposite, please. And that's what we want to see. So that's a good heel to shin test. Okay, now go ahead and sit up. I want you to close your eyes and put your palm out. This is 1 and 2 point discrimination. Close your eyes. And tell me if this is 1 point or 2 points.
1.
Okay. And tell me if this is 1 point or 2 points.
2.
Okay. Tell me if this is 1 point or 2 points.
1.
And tell me if this is 1 point or 2 points.
1.
Very good. Very good. Okay. Now close your eyes one more time. Put your hands out like this. Other way, please. Sit up straight. And close your eyes. And just tell me if your finger's in the up position or in the lower position, okay?
Up.
Good.
Down.
Good.
Up.
Good.
Up.
Okay, and that's testing proprioception. Now just go ahead and stand up real quick. We're going to take a look at just one of your joints. I'm going to choose your elbow. I don't see any redness, don't see any swelling, don't see any signs of inflammation. You're not having any pain in that area.
No.
Okay. Not feeling any nodules, not feeling anything. Okay, now we're going to do some range of motion exercises. So what I want you to do is go ahead and just stand beside me and I'll be with you for copying as much as I can of it, okay? First we're going to do your spine. And now, scoot just a little bit, there we go. So, first is flexion, touch your toes. Extension, go back. Rotation, twist. And then twist, rotation. And then lateral bending is stretching it that way. Sorry. Stretching it. Okay, next we're gonna do shoulders. Shoulders is pretty easy. Flexion is arms over your head. Okay, and then now extension is arms all the way behind. Abduction is out to the side, like you're making an angel or snow angel wings. Adduction is all the way back in and crossing over. Internal rotation, take your hand and put it on your back side up towards your shoulder blade. And then external rotation, take your hand and put it behind your neck. Good. Okay, elbow flexion is going to be just bending your elbow. And extension, straighten. Supination, like you're holding a bowl of soup. And pronation, good. For your wrist, we're going to do flexion. We're going to point towards the floor. For extension, we're going towards the ceiling. Adduction, we're going to move it towards the body. Adduction, away from the body. Now to do your hands, make a fist, flexion, extension, abduction, adduction. For your thumb, flexion, extension, abduction, and adduction, and opposition. Good. Okay, now we're going to test your arm strength and your leg strength. And I can see that your strength is equal bilaterally. And take a seat to the floor. And sit down. Put your legs up on my legs and just push. Like I'm a leg press. And I can see that you're bilaterally pretty strong. Okay, and now take my hands and squeeze my hands equally. Good. So you've got equal strength in all of those areas. As far as your walking goes, your gait, if I can just get you to stand up and walk over there, make a turn, and then walk back towards me, just like normal. Okay, we can see that your gait is smooth. You do turns smoothly. Your arms sway at the side. Very good. Now let's do your hips, okay? Assume the position over here. And some of this you may have to lay down, but in fact, go ahead and lay down. And just stretch out. And there. Scoot down some if you don't mind. Okay. So for your hip flexion, bend your knee and bring it up to your chest. Good. Flexion. Okay. Now flip over to get on your stomach to do extension. Thank you. And just lift your leg straight up, stretching that hip. Very good. That's extension. Okay, flip back over. Sorry. And move your leg all the way out to the side. That's abduction. Good. And then adduction. Good. And you're getting the hang of this. Okay. Now go ahead and bend your knee. And just drop it out to the side. That's external rotation. Now go this way. Internal rotation. Good deal. Okay, now stand back up. Thanks. Need you to take, look at your knees. Go ahead and squat. That's flexion. Back up is extension. Good. Go ahead and take a seat. Okay, internal rotation. Swing your leg. Swing your leg out this way, your lower leg. Yeah.
Oh.
Okay, and that's good. That's external rotation, and then very good, internal rotation of the knee. Good. Okay, now let's do some ankle stuff. Okay. Flexion. You have to copy me.
Oh.
Okay. Flexion. Toes to the floor. Extension. Toes towards the ceiling. Abduction. Out. Adduction towards your, like your pigeon toed. Very good. And then we're going to do some toes. Abduction. Spread your toes apart. Adduction. Bring them in. And without moving this, flexion and extension, push your toes up, and extension. Well, I moved my feet. Good. Okay, so that completes all of the range of motion. You seem like you're healthy and in good shape. Now, if I can get you to lay, go ahead and just lay down. We're going to take a look at your stomach, and if you will just kind of pull your shirt up some there, and if you can scoot over a little bit. Okay, we can see the skin on your stomach is intact. I don't see any vascularities. There's only just a small amount of hair. I don't see any pulsations. I don't see any visible signs of peristalsis. Obviously, I don't see any lesions, and your contouring is pretty, what they call scaphoid. It means it's concave, which means you've got a pretty flat stomach. Your umbilicus, your belly button is midline. And I'm going to go ahead and take a listen to all 4 quadrants, okay? So I'm hearing mouth sounds are pretty active in all 4 quadrants. And I'm just going to palpate on your stomach, and your right upper region, for example, houses your liver. Your right lower region would house things like your appendix. Your left lower region houses your descending colon. And then your left upper region houses, for example, your stomach. You have any questions?
No.
Do you think it went well?
Sure.
Yep.
Yeah.
Okay. You can go ahead and cover your shirt up. So we'll see you next year, huh?
I guess so.
Okay.